Going to the next question, another interesting question. You are not supposed to make such questions wrong in the exam. So this is the second question here. Again, which of the following is the most likely cause of these findings? Now look at the options. Whenever you are in the exam hall, you are solving a grand test, look at the last line, look at the options, because then you get to know that what is this question about. Aneurysm of PCOM, superior cervical ganglion compression, trochlear, scleral venous sinus, so something related to nerve compression, related to the eye is what we can gauge from here, right? Now look at this, the visual acuity is within normal limits. When the eyelid is raised manually, the eye is fixed in the out position and the pupil is dilated. Does it give me some clue? Yes. What are the other clues? There is ptosis which is there. So connect the dots together. Ptosis, out position, pupil dilated. What nerve are you thinking about here? Which nerve is injured? When you have ptosis, how is the eyeball? Down and out. How is the pupil? The pupil is dilated. All these features tell you that this is third nerve palsy. Okay, this is third nerve palsy. So the question is about third nerve palsy. You get ptosis in third nerve palsy because the LPS is affected, right? Down and out. Why do you get down and out? Because remember that extraocular muscles all are supplied by 3 except SO4, LR6. Superior oblique by 4 and LR by 6. Superior oblique, remember obliques cause opposite action. The name is superior but the action is opposite. It causes depression, that means down going eye. Lateral rectus takes the eye laterally, lateral is out, and that is why these two muscles are spared here in third nerve palsy, and that is why superior oblique, lateral rectus, it is down and out. Okay, the nerve, the eyeball is down and out. Why is the pupil dilated? Because the third nerve is a parasympathetic nerve, right? It's a parasympathetic. 3, 7, 9, 10 cranial nerves are parasympathetic nerves, and parasympathetic, remember cholinergic, very, very important mnemonic again, cholinergic constricts the pupil. Okay, cholinergic constricts the pupil. So that is why there is no pupil constriction happening, and that is why there is pupil dilatation. So when you have third nerve palsy, what do you think of? Aneurysm of PCOM. Very, very important. PCOM aneurysm is a very important cause of third nerve palsy, because if you have a look at the course of the third nerve, it is related to the PCOM and the PCA artery. So you have the PCA and you have the PCOM joining with the ICA, and here goes the third nerve. So aneurysm of this compresses the third nerve, causes its palsy. Now my next question to you is, this third nerve palsy caused by aneurysm, will it affect the pupil or will it not affect the pupil? So when you have aneurysm compressing on the third nerve, remember pupillary fibers, P for P, are peripheral fibers and they get affected. Okay, the aneurysm compresses on that. Versus in which condition, very, very important, AIIMS asks this question very frequently. Where do you see pupil sparing third nerve palsy? Where do you see pupil sparing third nerve palsy? Pupil sparing third nerve palsy, very, very important. Remember, it is seen in diabetes mellitus. Very, very important, where this is microvascular ischemia causing the palsy, which affects the center and not the peripheral fibers first. The central fibers are affected. So very, very important, diabetes mellitus is pupil sparing third nerve palsy because it affects the center and not the periphery. The pupil fibers are present peripherally, so if there is an aneurysm coming from outside, that compresses the pupillary fibers and causes pupillary manifestation. Going to the rest of the options, compression of the superior cervical ganglion. Remember sympathetic hai ye, sympathetic wale ka, this will lead to Horner syndrome, which has pupillary meiosis, constriction, meiosis, anhidrosis is what you see here. Damage to trochlear nerve, fourth nerve, SO4 will be affected. The patient will have the head tilt, right? And the patient will have the chin depression. So that is what is going to be with the, and there's going to be hypertropia. Occlusion of scleral venous sinus, that is the canal of Schlemm. This is going to lead to angle closure glaucoma, which is an acute painful condition with a fixed dilated pupil. Right, it's an acute painful condition with a fixed dilated pupil. Red eye will be there. It is angle closure glaucoma. So I hope everybody is clear that the answer here is PCOM aneurysm, third nerve palsy is very, very important here. Okay. PCOM aneurysm, third nerve palsy is a learning lesson here. You should never ever forget this. Okay. You should never ever forget this.